Hello, Dr. Abby. Today I decided to choose option number B, and the visual poster I have included before this presentation, and you can pause to look more at it, and I will be explaining the tips that I included in the video ahead. To start off, dementia is a disease that has significant impact on the patient's emotional, physical, and mental well-being. According to the Public Health Agency of Canada, 2024, there are currently 477,000 Canadians who have been diagnosed with dementia, with the majority aged 65 and older, and this number is projected to almost double in the next decade. This visual poster is tailored for early dementia patients residing in nursing homes with positive psychology tips specifically aimed at this demographic. Early stage dementia includes symptoms of memory problems, reduced concentration, agitation, behavioral changes, apathy and depression, loss of ability to perform daily tasks, and personality changes. It's crucial to acknowledge that dementia manifests in various stages, with each patient progressing uniquely. Consequently, it's challenging to generalize the effectiveness of positive psychology approaches for each individual and for every stage. This being said, I believe that the tips provided in the visual poster are beneficial in aiding patients to experience positive well-being beyond the disease narrative and focus more on how to cope with dementia in a positive and healthy manner. Positive psychology coaching has not been fully researched when it comes to this population. Therefore, I chose to apply aspects from various models such as the PERMA model. The first positive psychology tip is to encourage the patients to practice gratitude journaling daily, which is a strength-based activity. The recommended number of points to be written should be around 3. However, the practice of gratitude is more important than the number of points written down each day. This should be written with positivity. For instance, journaling, I watched the sunset today and the scenery was beautiful. Therefore, it is significant to express appreciation for the positive aspects of their lives, which will allow for better reflection and feelings of gratitude. It has been proven that gratitude activities help in increasing feelings of happiness, as it allows for an increase in positive emotions and mood. Moreover, this technique is beneficial in enhancing self-perceptions and acceptance, thereby emphasizing 2 key aspects of happiness, the affective and cognitive components. This activity is significant when looking at early-stage dementia patients as it increases positive emotions, which could help when it comes to feelings of apathy. The second positive psychology tip is to have the patients engage in pleasurable activities. Encouraging and motivating the patients to participate in the activities that they enjoy will help boost their mood, self-view, and self-efficacy. At this stage of the disease, this approach is particularly noteworthy. Data from numerous nursing homes indicate that caregivers often assume patients are incapable of self-management or participation in activities. However, in many instances, this assumption is not accurate and can accelerate the deterioration of the patient's ability to self-manage. This will not only improve self-esteem, but it will also increase their happiness, which is prevalent due to high probability of depression that occurs during this stage of the disease. Another positive psychology tip is to aid patients in identifying and recognizing their personal strengths, which will emphasize their intrinsic and extrinsic strengths, allowing for improved self-esteem. These strengths have to be positive, as this is proven to aid in dealing with challenges and weaknesses, as well as enhancing overall health, recovery, and healing. In addition, strengths and resilience are interchangeable factors, which are significant when it comes to dementia. Building resilience will enable patients to withstand adversity and manage difficult situations more effectively. After recognizing those strengths, it is also important to start helping them reinforce those strengths in order to build and improve their adversity, resilience, and growth when it comes to cognitive, behavioral, and attitude conflicts. Emphasizing the patient's strengths will enable them to perceive themselves in a positive light, improving their self-assurance and self-confidence. This is particularly crucial, considering that one of the symptoms observed in early-stage dementia involves behavioral and personality alterations, often resulting in diminished self-esteem. In addition to the other suggestions, this positive psychology tip centers on the nursing home fostering group activities, encouraging social interactions, and facilitating sharing of successes. Implementing these practices will afford patients a sense of universality and support. It could also offer opportunities for connections and relationships to be built, which will lead to feelings of belonging. Furthermore, exchanging accomplishments with one another will cultivate an environment of celebration and enhance perceived self efficacy. This tackles the concept of thriving and flourishing, as it includes the major aspects of the PERMA model, including positive emotion, engagement, relationships, and accomplishments. This will help create an environment for the patients to feel good, share a compliment, and have positive interactions, which will lead to emotions of motivation, growth, and increased meaning of life. Another tip is to set meaningful goals by assisting the patients to set achievable short and long term goals and reminding them of these goals every once in a while. It is essential to some of these goals to incorporate elements of learning, physical activity, and contributing, aligning with the concept of wellness. This holistic approach covers a broad spectrum of actions that contribute to overall well being. The integration of physical activity in this is highly important as it helps with improved mental health and slows down cognitive decline. It is important that these goals are tailored to their capabilities and abilities, as the goal of this activity is to achieve a feeling of accomplishment and direction. I believe that the best strategy to use when assisting patients is the utilization of the SMART goals technique. By doing this, the patients will be able to set realistic and attainable goals, which will aid in enhancement of perceived purpose, self-worth, and self-efficacy. Also, adopting those meaningful goals is shown to reduce feelings of stress and depression, which is highly prevalent in patients with dementia. Lastly, the following 3 positive psychology tips focus most on having the patients become more aware of their feelings. Firstly, practicing breathing and relaxation techniques will be beneficial in reducing stress and promoting calmness. This is significant as many patients with dementia struggle with high levels of agitation. Secondly, patients should practice self acceptance through the guidance of caretakers, helping them engage in activities that will focus on accepting and acknowledging their positive and negative characteristics. This is highly essential as a method of psychological coping and well being. Thirdly, encouraging patients to express their emotions freely, as this will create an open and supportive environment in which patients can manage and regulate their emotions, as well as cope in a better way with some of those emotions. All these positive psychology techniques will help patients in managing their emotions more effectively, enhancing their quality of life, and reducing behavioral symptoms associated with dementia. This focuses on the concept of wellness as it aids the patients in becoming more aware of their sensations, thoughts, and feelings. In addition, mindfulness practices help increase a positive state of mind as well as heighten self knowledge. Overall, while dementia is a chronic neurodegenerative disease that causes devastating challenges when it comes to the patient's emotional, physical, and mental well being, integrating positive psychology coaching tips can offer significant support, especially in early stages of disease. The positive psychology coaching tips have the capacity to offer early stage dementia patients with the ability to foster resilience, adversity, and transformational growth. Encouraging activities such as gratitude journaling, identifying personal strength, engaging in pleasurable activities, and setting meaningful goals can enhance positive emotions, social connections, and overall quality of life, as well as increase happiness. Furthermore, promoting group activities and social interactions in nursing homes can help patients gain a sense of belonging and accomplishment, which could help in alleviating symptoms of depression and apathy. Lastly, mindfulness activities can help patients with stress reduction and emotion regulation, and this will lead to improved well being and cognitive functioning. In conclusion, focusing on implementing those tips in nursing homes by caregivers can help individuals with dementia navigate the psychosocial challenges of the disease with resilience and optimism. Thank you so much for listening.